Howdy, y'all. Come warm your feet by the fire while the Chislers and the gang spin you a little cowboy tale about dry needling. Seeing a time before time really mattered in 2017, this trailblazing feller named Gildir wanted to investigate the efficacy of using dry needling on active trigger points to treat chronic tension headaches. Ain't that right, Maud? Boss? Cookie?
Well, I heard that challenges modern Western medicine. Can I just get some medications?
Well, hold your britches, host. There's better ways of going about things than taking medicine.
Yeah, Hoss, just look at this randomized double-blind parallel group trial.
That's right, Maud. Study here had great results regarding the frequency, intensity, and duration of chronic tension headaches.
Well, partner, you can't be believing every damn paper you hear out here in the West.
Well, they had a p-value of less than 0.05. And the headache started declining after the first week.
They even used the old Cohen formula, the effect size, to determine mean difference between groups to conclude that dry needle is indeed effective.
Is that a fact?
Dry needle only had an effect size of 4.3 at the end of treatment, 3.3 at 1 month follow-up. Intensity was measured on a visual analog scale. And the sham group didn't even have a change at the end of treatment. 1 month follow-up, they had an increase of 0.3.
What about frequency?
Frequency decreased at end of treatment, changed by 6.4 and 4.9 at the end of 1 month in dry needling group.
Even the duration had significant difference, with the dry needling group showing a score of 4.3 and an increase at the follow-up 4.9, while the sham needling, they're at the negative 0.1 and negative 0.4.
Pretty strong study if you ask me. Randomized double-blind with a sample size calculated with G-Power software. Heck, they even went 25% above power analysis and put 80 people in each group. Why wouldn't we dry needle people?
Hey, Chisler, don't look now, but I see some trouble over yonder.
That's right, Cookie. There's lots of bad critters in these parts.
Well, it ain't the Chislers.
Look, it's them stunt doubles from Brokeback Mountain. White Claw, Hefe?
Ma'am?
You been spreading nonsense to these kind folks? I thought we sorted this out in EIP1.
The Chislers an ordinary cuss, but you're right as rain. Did he even think about validity?
I bet he didn't even do a Pedro.
Oh, hush up, White Claw. This study had base, content, and construct validity.
Ha! Concurrent, criterion, predictive?
Mind your manners, Jefe. That's a lady.
Her mustache begs to differ, and so do we.
Ha! Good one, Hefe.
Oh no!
Calm down, horse.
Well, Chisler?
Subjects were randomly assigned, and those assessing them were blinded to the study.
Get him, Chisler!
I'm not impressed.
Patients also had pre-treatment similar demographics and characteristics.
Subject and data collectors were both blinded.
But the PT doing the dry needling wasn't he?
No.
Was the follow-up time frame long enough for outcomes of interest to occur? Well, was it? What about a new set of subjects?
The author suggests longer-term studies should be performed, and no, new subjects were assessed.
Well, I suggest you skin that smoke wagon.
I'm your Huckleberry White Claw.
Well, you're shooting blanks.
That's what she said.
Short form 36 is a reliable measure. It's been validated. All subjects were treated the same, and there was only attrition after week 2. That subject had a drop because of medications. No one else dropped. There's 80 subjects in each group.
What about internal validity?
Testing was not a threat. There was no selection bias. Maturation was not a problem.
Same instruments were used, and there was no experimental mortality.
It was unclear if the groups interacted, but they were blinded, so shouldn't be a problem.
The history was unclear since we don't know if subjects were familiar or had researched dry needling.
Ha! What about external?
Oh, Hefe, as sure as the sun rises, this is externally valid. You could apply it to anyone in the population with chronic tension headaches.
That's weak.
Pardon me, Claw?
They only use active trigger points. 5 patients reported fear and pain. No long-term effects were investigated.
There's a large sample size. The specific population included exclusion criteria and inclusion criteria. And there's not even experimental bias.
In the name of science, prepare to be chiseled. Chislers, mount up!